Have you ever any experience about
Not yet.
Nobasteem? I've been worked with that level mat over 10 years. We are very familiar with the PRP, but the Nobasteem is very different. Hello, I'm Dr. Kang from Seoul. This is my own clinic. I'm just focused on the cellular treatments about the anti-aging and the general conditions and the aesthetic, like facial problem. I think my experience can be shared. I also focus on the new generation of the treatments. Thank you.
Okay, my name is Dr. Edwin Chang, also known as Dr. E. I'm from Malaysia. I'm a doctor for almost 30 years. Now I'm a longevity doctor. I'm running 2 clinics in Malaysia. My special interest is the neurodegenerative issue with the stem cell as well. Reason is to explore more on the regenerative medicine, what we can do.
Have you ever any experience about
Not yet.
Nobasteem?
Not yet.
Yeah.
Because of if you have not registered in Malaysia yet.
Actually, I've been worked with that level mat over 10 years. We are very familiar with the PRP, but the Nobasteem is very different. We just focus on the PBMC. PBMC is a mononuclear nucleoside. 10 years ago, we think about PRP, but nowadays we think about the white cell. I mean, is that the mononuclear nucleoside, neutropy. So they can control that immunologic reaction. So we believe the immunologic the condition, and we can think about the immunologic reaction can be activated by the action outside of the body, like MCT, high spinning, the rotation of the high G. This changes the property.
So in what indication you use this?
Generally, I think immune improving. Yeah,
Okay,
so not just only the anti-aging, the immune reaction can be improved. And some people say they are suffering from the psoriasis. This can be improved by just the injection of the Nobasteem.
Just one time. You see
No,
that?
not just one time. I did 3 times. It's really quickly improving. Yeah, it takes time to improving at least 2 or 3 months.
Was it your standard protocol, like 3 times? Every patient have to go to 3 times?
Yes, 240 cc's.
Oh, okay.
It's quite a lot. It's quite a lot. I cannot believe that make a standardizations about the treatments.
Like precondition your patients before.
I do the
precondition.
hyperbaric and the nutritions.
Okay.
And then the nutrition infusion.
Basically, you try to reduce the bodily inflammations
Yeah,
before you
sure.
harvest the blood. Because I'm doing the autologous exosome, I using the same methodology. I precondition the patient for about a month before they come in.
My preconditioning time is just 2 weeks before.
I guess every individual is different.
Yeah, sure.
After you done that, how long you could sustain the result of this?
I did 2 weeks later. End of the 3 times, it means that 6 weeks later, it's gone really subsided. I was also very surprised because I'm quite dermatologist, so I know that the nature of the PR. It takes time. It's really significant changes.
I think I did a lot of ADSC. I used a lot of 듀오셀 from RefMed. Yeah, a lot of things surprised me. I went on to treat untreatable disease, many untreatable disease, like Parkinson's cases, cerebral palsy kids, and almost terminal. But these patients improved dramatically. I even have patients are on the wheelchair for 7 years, like on the myotonic dystrophy cases. After 6 months, she stood up and walked. That surprised me.
Okay, let me ask about it. In Parkinson or dementia, it's very neuronal disease. So usually, it's a BBB. We can through that. So how we can explain about that improvement?
I do spinal.
Do spinal.
Oh. That's the only way. Can you make ADSC into a nanoparticles? Exosome can cross easily to the brain, but exosome doesn't have the differentiations property. It only very good in inflammations. Most of the neurodegenerative issues are due to neuroinflammation, but it doesn't improve cellular function, only reduce the inflammation. Recently, I did quite a number of cases for neurodegenerative using an autologous exosome, which I give through nebulizing and IV. It does improve. But again, it's not sustainable. Because Nobasteem comes with the exosome, right?
Yeah, sure.
I think that particular thing, I think can cross blood-brain barrier.
Sure, I think so. We're gonna try to what can change it in the body, the signals. So sometimes we try to find out the serotonin and homocysteine and vitamin C, other kinds of telomere. We're going to try to find out in the study. But we can see that some result is quite earlier stage, but we can see the homocysteine and the vitamin C and some serotonin, they can change it after treatment. 2 weeks or 3 weeks later.
The reason why I'm so interested in, my special interest is in the neurodegenerative. I believe we are entering the silver economy now. More people at 60 years old right now, but people don't die. People getting sicker. And it's very sad to see patients on dementia and also on the Alzheimer and Parkinson's. And this can happen to our parents anytime.
Yeah.
So I try not to wait, but proactively give them this kind of injection, especially those who have a very strong history in family history. I get them on the board first and inject them first over the next few years and see how. You see, it's still very new.
Sure. You are the really frontier.
So I guess, okay, you can do, I think it's not difficult to do a spinal injections. In fact, it's very easy. I think that's the only way for the stem cell to cross.
In Korea also, some doctors are gonna try to the injection into the spinal. So they try to with anesthesia, but some people they do it by himself. He is a neurosurgeon, so he can do it easily. This is now in Korea also. This is just a trial, but
Have to be careful.
yeah, sure, yeah, I know.
When I visited China about 2 months ago, there are about 400 million people are entering the silver economy. We have entering the silver economy in a very big way. I think we as a doctor have a great responsibility to make them functional, as well as help them live longer, happily, and also don't die in the hospital. Right. Thank you. Thank you, sir.
Thank you for your.
Thank you.